Welcome, my dear friends. How are you? Fine? Yes, good. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, I have the expert team of the doctors, so you can definitely WhatsApp me only on 922-6810-630. My dear friends, the number is always there in the description. My dear friends, this is the series going on regarding the clinical examination of the patient in general medical practice, that is GP. How we doctor come to the final conclusion, how we doctors make the provisional diagnosis. So different problems. Today I am going to discuss with you the patient comes to us or come to us regarding the general weakness and tiredness, fatigue. So how we think about this patient, general weakness. So 32-year-old male patient came to me and he is complaining. The patient is complaining, doctor, I don't know, but I'm feeling very weak and tired. Since last 1 month, I'm very much problem in my regular performing the office duties. Actually, you see, doctor, that I don't have any fever. I do not have any cough, nothing at all, but I am feeling very tired. Oh, I see. I'm thinking in my mind, 32-year patient, okay? So this is a middle-aged patient complaining of fatigue or the tiredness. Is it a diabetic? Is this patient may have the diabetes, and because of the diabetes, he may have that particular weakness. But to make the diagnosis, I have to go further step by step. First, I will ask him, because I have the little bit immediate lightning in my mind about diabetes. So I asking the patient, hey guy, do you feel thirsty frequently? Do you pass the urine more frequently? No, doctor, nothing like that. Is your appetite or hunger is good? No, that means, well, there are actually, I don't have any problem about the appetite, so I don't think so. So I think I was thinking about diabetes. Also, I'm thinking whether the patient is having anemia. So I started accordingly, because I think that patient is not thirsty, patient is not passing urine frequently. So don't know. So maybe don't have any diabetes problem. So let us talk about the anemic condition, or try to check the patient for the anemia. So I will ask the patient to lie down, ask the patient to show the tongue. And if I see the paleness of the tongue, then I have, okay, this patient may have less hemoglobin or less RBC count, and he may be anemic. Then I will check the conjunctiva. Can you see here? And lower borders of the conjunctiva, that paleness is seen. So if it is a severe paleness, that can be the cause of anemia. Then I will also look for the white part of the eye, that is sclera. If there is any yellow color, that is called as icterus. So sclera, if it is a icterus of the yellow color, I must think little bit about hepatic problem, liver problem. It may be jaundice, or it may be viral hepatitis B also. Then I will ask him about any addiction, whether you have addicted to the gutka, tobacco, or do you drink alcohol? No, doctor, nothing of that sort. I do not have any that type of the vices or the addiction. Okay, okay, no problem. But then I will ask the further, do you feel breathlessness on walking? That means after you walk, after you upstairs, do you feel little bit breathlessness? Also, I will ask, do you have any cough? Although he has mentioned, but I will confirm it. Low grade fever or the sweating, because these all the symptoms may indicate tuberculosis. But fortunately, patient is saying, no, no, doctor, I do not have the breathlessness. I do not have the cough. I do not have the low grade fever, especially in the evening. I do not get the night sweats. So I am relaxed because the patient is not of tuberculosis, because weakness is always also accompanied the chronic infections like tuberculosis. So weakness is very common in tuberculosis. So I must rule out the possibility of tuberculosis. But at the same time, in addition to the symptoms, I will definitely check, yes, with the stethoscope, I will check the chest region for lungs and also for the heart. I will check the respiratory sounds on both the parts of the lung, anteriorly, axillary part, and also posteriorly. This is called as the auscultation. Auscultation is very important to rule out the respiratory causes or to rule out the cardiovascular causes related with the heart. So I will check whether the normal lung sounds, vesicular sounds are there, bronchial sounds from the trachea, or is there any other sounds like, for example, rals, rhonchi, wheezing, crepitations, and most important, in the tuberculosis, there may be pleural rub at some times, pleural rub at the base of the lung. But for this patient, I have not found anything. Then I check the heart sounds, lub, dub. Is there any murmur or the pathological heart sound like lub, sh, dub, lub, sh, dub? This sh word, it indicates the in between abnormal heart sound and which is called as a murmur. But fortunately, nothing is there. Again, I will go for the abdominal examination. I will ask the patient to lie down on the examination table. Ask the patient to fold the legs in the knee. That means take the legs near to the abdomen to make the abdominal muscles relaxed. Then I will check carefully the palpation of liver and palpation of the spleen. Try to understand in the adult, male or female, liver and spleen are not palpable physiologically. So if the liver or the spleen is palpable, there must be some problem. So I am just checking, and also I am looking for the epigastric lump. Carcinoma, that is cancer of the stomach, and cancer of the liver must be ruled out when you are talking about weakness or the tiredness in middle-aged person or the ladies. Now I will ask whether a guy, if he is a male, do you have the sexual weakness? He said, no, 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 doctor, nothing of like that. This is a direct question because you try to understand many patients feel shy or awkward to express sexual weakness and just present as a general weakness. But that general weakness is he wants to tell about sexual weakness. So you must ask straightforward and direct question. Then also you can ask any history of exposure to the venereal diseases. For example, HIV. We have to rule out because that can be rare, but one of the important cause for the weakness. Now I will go further and try to talk about thyroid or discuss or check for the thyroid. Especially I will check the probability of myxedema. Myxedema is a hypothyroidism. Of course, for all this matter, I am doing the clinical examination. But at one time, I will do also some investigations afterwards. I am going to tell you about the investigations. I am talking about thyroid because hypothyroidism, which is called as a myxedema, also can cause weakness in middle-aged person. So I will check the pulse, whether there is a low pulse rate, bradycardia, whether there is a change in the voice, like hoarse voice. Then I will also check the deep reflexes, because delayed relaxation of deep reflexes also can indicate the myxedema. But the most important, the weight gain, and second most important is also swelling of the face as well. So I have to check the myxedema, because myxedema also can cause the weakness in middle-aged patient. So in short, let me give you the very important points for diagnosing the fatigue or the weakness in middle-aged patients. You must rule out the diabetes mellitus. You must rule out, doctor must rule out the anemia, low hemoglobin. Normal hemoglobin is 12 to 14 gram%. Doctor can check for the tuberculosis, HIV infection, myxedema, rheumatic heart disease like mitral stenosis by a murmur, malignancy of the liver, malignancy of the stomach, any addiction problem, any sexual weakness. So these are all the things doctor has to check during the clinical examination. If clinically the patient is seen to be normal, but I must do some pathological investigations to confirm my diagnosis. That means nothing abnormal is detected, NAD. So I will go for the CBC, complete blood count, or hemogram, which will give you the value of the hemoglobin or the RBC. Hemoglobin normal 12 to 14 gram. If it is less than 10 gram%, there may be a little or the mild anemia. If it is below 7 gram%, moderate anemia. If less than 5 gram%, severe anemia, the patient must be admitted in the hospital in severe anemia for blood transfusion, because cardiac arrest can occur in severe anemia. Then I have to do the fasting and post-glucose blood sugar level, glycosylated hemoglobin, which can give the average of the 3 month of blood sugar. Then I must do the HIV combo test for P24 antigen and also HIV-1, HIV-2 antibodies. Then I must do the chest X-ray to rule out the tuberculosis. I must do the urea and creatinine, that is renal function test, to check the status of kidney, because renal failure also can cause the weakness. If all the investigations are normal, then of course we give the best tonics as much as possible. For example, according to the Prakriti, we can advise about tablet Ashwagandha or Ashwagandharishta. We can advise for Chavanaprash. There are Suvarnamalini Vasanta, Bruhatavata Chintamani, the different antibiotics that we can prescribe. But in the modern pathy, the doctor can prescribe the Biplex tablet or Durabolin. Then I will ask for the aerobic exercises or the simple walking for 45 minutes. And as and when required, if I find that stress factor is there with this weakness, then I can give the antidepressant. In Ayurveda, we always recommend tablet Prashama or the liquid Prashama of Ayurveda Shala Pune for mind relaxation, 2 spoons at the bedtime. So my dear friend, this is all about the weakness of the middle-aged patient. I hope you like this discussion. And similarly, we are going further for many these type of complaints. So don't forget to like and share this video, and also subscribe my channel to give the boost for Dr. Deshpande's efforts. Thank you very much. I wish all the best. Take care and see you soon. Thank you very much.